Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Bostix series. This audio podcast as part of a LaBox Infaction. This audio podcast as part of a Storm Quota, and this audio podcast as part of a Storm LaBostics production. In this audio podcast, looking at the intro. Looking at the intro to works in regard looking at the intro in regard to works at healthcare education for practice excellence. And this work and this series will in this series as part of this series we'll look at look at some pilot based data. So a bit of intro. So patients diagnosed with long-standing conditions or long-term conditions are perhaps the most rigorous consumers of healthcare, as according to works and evidence works from 2014 or published works in 2014. A general practice GP practice or general practice will have around 10,000 will have at least 10,000 will have at least 500 patients or recipients with CKD stages 3 through 5. Approximately 15 to 20 of these in CKD 4 and 5, and around 5 to 10 patients or recipients in CKD 5. A more elderly and deprived practice population is likely to have a higher prevalence, and full details of sort of the current prevalence or prevalences and sort of epidemiological data in around stages 3 through 5 are documented and evidenced in the UK, in amongst the UK renal registry. About 90% of patients or recipients with CKD 3 through 5 will have could have sort of morbidities or comorbidities. These are the all-cause mortality rate in CKD is 30 to 60 times more higher than in in the general population. Patients are now being prompted more towards sort of self-care aspects of self-care, and this can cause sort of anxiety and stress triggers. Therefore, it is important to gain a better understanding or insight into healthcare service provision for patients. That draws this audio podcast to a close. This audio podcast as part of a Bostix series. This audio podcast is part of a LaBox Infaction. This audio podcast as part of a Storm Quota. And this audio podcast as part of a Storm LaBostics production.